In this lecture, I will present a short comparison among the three types of maxillary molars. These are the maxillary first, second, and third molars. First, I will compare the three regarding the number of developmental lobes. The maxillary first is normally developed from 5 lobes, the second from 4 lobes, and the third either from 3 or 4 lobes depending on the type, whether it's heart-shaped or rhomboidal. Each lobe will form a cusp. Therefore, the maxillary first molar has 5 cusps. 4 of them are functional, while the fifth one, or the cusp of Carabelli, is non-functional. Regarding the eruption and the first evidence of calcification, the first molar shows the first evidence of calcification at birth. So they are considered, whether they were maxillary or mandibular, the first teeth to show evidence of calcification, and they are the first teeth to erupt into the oral cavity at the age of 6. The second molars erupt at the age of 12 years, at the end of the mixed dentition period and the beginning of permanent dentition period. Third molars erupt even later, between 17 to 21 years of age. Therefore, they show first evidence of calcification very much later compared with the other permanent teeth at the age of 7 to 9 years. Comparing the three types of maxillary molars in overall dimensions. The second molars are shorter and narrower mesiodistally compared with the first. The third molars continue to be smaller in this dimension compared with the other types of molars. The second molar is broad buccolingually, just like the maxillary first, while the maxillary third show less buccolingual dimension, therefore it's smaller in all dimensions, mesiodistally, buccolingually, and in crown length. Root length and configuration. The first molar has the longest roots, the third has the shortest, therefore root length becomes shorter as molars move distally. The roots of the second molar have a tendency to be more convergent compared with the first. The third molar shows even more tendency for convergence, and even the roots may be fused in one single large root. Occlusal aspect. Outline of the occlusal surface. First molar show rhomboidal occlusal outline. The second molar also shows, in most cases, rhomboidal outline. However, it's more accentuated since the mesiodistal diameter is less than buccolingual. Occlusal outline for the third molar is heart-shaped when it's presented with 3 cusps. Fifth cusp is considered a characteristic feature for the maxillary first molar. It's present on the lingual surface of the mesiolingual cusp. It's absent in the second and third molars. Oblique ridge is a characteristic feature for maxillary molars. It is less prominent in the second molar and may be even absent in the third molar, especially the 3-cusp type. If the third molar is presented with a 4-cusp type, it will show oblique ridge similar to that found in the second molar. Another feature is that the distolingual cusp, which becomes progressively smaller as we move distally, is less developed and smaller on the second molar. The distolingual cusp continue to become smaller in the third molar, and sometimes it disappears entirely, especially in the 3-cusp type. So it will be presented only with 1 large lingual cusp and 2 buccal cusps. Occlusal surface shows more supplemental and secondary grooves and pits when the molars are farther distally. More grooves will be seen in the third molars and less will be seen in the first molars.